Welcome to Center of Balance Live. I'm Sinan Pua from Center of Balance. Today our topic is free to learn acupoints for Frankton's miscarriage. If your first time watching this video, please give me a thumbs up and like this video as well. Subscribe to my channel and ring the bell if you are on YouTube. If you're on Facebook, please say hi to me and leave a comment down there. Thank you. Now, we're talking about Frankton miscarriage. Now, if you have any experience that you have your mom, you have experience with this in the past, please comment down there and just reply one. Simple. Now, if you know anyone who has the experience of this, please reply 2 so I know how many people watching this actually have friends or family or herself suffer from this. Does it make sense? Thank you. Now let's talk about, today I'm going to talk about what is Frankton miscarriage, and then I'm going to show you some acupressure point for it. It's a bit different. For most of our acupressure point, we use our thumbs and fingers or some tool to press and hold or press and rub to do some massage on the point we call acupressure, right? But today is a different, very different. With those acupressure points that I'm going to show you, it's not to do with acupressure point. You don't actually press and rub on it. You actually use some other tool to burn the point on top. When I say burn the point on top, I'm saying moxie bashing. I'm going to introduce moxie bashing later on. Let's start with what is Frankton, what is a Frankton miscarriage. So a Frankton miscarriage is vagina bleeding that occurs in the first 20 weeks of pregnancy. The bleeding is sometimes accompanied with abdominal cramps, but not just abdominal cramp. It could be pain in the lower back, right, on this area, sacrum area, or here, and it could be sharp pain, and it may come with some, in the bleeding, it may be some clots in there too. So these symptoms indicate that a miscarriage is possible. So you need to take very seriously in this case, right? But which is why the condition is known as a Frankton miscarriage, or we call it Frankton abortion. Vagina bleeding is fairly common among pregnant women. About 20 to 30%, that's quite high, isn't it, of women will experience bleeding during the first 20 weeks of pregnancy. Approximately 50% of these women will carry their baby to term. So 50% of them, now you see, we have 100 pregnant women, 20 to 30 of them, let's say 20 or 30, right? 20 to 30 will experience vagina bleeding, right? And in this 20 to 30%, 50% of them carry the baby, no problem, until labor. Now another 50%, which means another 50% miscarriage, which means 10 to 15 of each pregnancy miscarriage. All right, so this is quite high, 10 to 15 So it comes to important that when you or your friends experience threatened abortion, threatened miscarriage, then you need to take some action for it to prevent miscarriage. Does it make sense? So the exact cause of threatened miscarriage usually isn't known. However, it's more common among women who have previously had a miscarriage. Which if you had a miscarriage in the past, and then you're more likely, when you have bleeding in your next pregnancy, you're more likely to cause to get miscarriage. Now there is no, I've asked a lot of patients in my clinic when they come, they say they have miscarriage. I say, have you ever have any tests or known any reason? No, none of them could tell that they have a reason. So sadly, in New Zealand, when you there's probably some tests. There's some tests you can take before you get pregnant, or if you experience the first miscarriage, please do the test. It's called clotting test. Clotting test. Just take a blood, and then you know if you have clots. If your blood is too thick in your body, then in the next pregnancy, when it comes, you just go to a doctor and ask for aspirin. You say, well, I'm pregnant now and I want to prevent miscarriage. What can I do? And my last test told me that I have clotty. My clotty test is actually positive. Then the doctor will prescribe you aspirin to thin the blood a little bit. Then make sure that your blood can go into your placenta, to your tummy, to uterus, to provide the right amount of blood flow to your baby. Does it make sense? So it could be very simple. When I say sadly in New Zealand, it's because you have to experience 3 miscarriages before they give you the test. So that is very, very sad to hear that, right? So what I suggest my patient to do, the reason they wait for 3 miscarriage for you to do a test, for free test, why don't you just pay it yourself and get the clotty test done? That makes sense? Yeah. So that's important. If you experience your first miscarriage, please, there's no reason. They can't find, most of the time they can't find any reason for it. Most of the time, in some other cases, they may find some reason for you. If they can't find any reason, please go and get a clotty test. It's a blood test, and if the doctor, and if in New Zealand, and they say, well, you're not qualified for that, please say, I'll pay for it myself. Now, if you prepare for pregnancy, this is the test that we actually recommend you to do as well. All right. Okay. Next, I'm going to show you the acupressure point. The acupressure is pretty easy. All right. So one point on the top of your head we call Bai Hui point. The Bai Hui point is like this. That's how you locate it. Both of ear. Let me show you in here. This is over here. This is the Bai Hui point. This is the point. All right. So point, how you locate it? Both ear go up there, and then right from your nose go up there at the junction between those, and then you find the most sensitive one. You can press it and find, or you go like up and down like this, and you find a bit of hollow in there, and that's the point. That's exactly the point. Then what you're gonna do? Get a moxie button stick. This is smokeless, and this will cause a lot of smoke. There's a different stick. Moxie, you can see a lot of herbs in there. It's a different one. So we recommend that one. So what happened is you get a ginger, kind of piece of ginger, and then use a fork and just make a lot of holes on top, on both sides, so it can go through, the heat can go through easier. So how thick is the ginger? It's about New Zealand coin $2 size coin thick. All right, so make a lot of hole in it and put it on top of this point, and then burn this moxibustion stick, then put it on top like this. Do not put it on the ginger, it's just away from the ginger on top. If the ginger is, if that is ginger, you put it on top of the point, and then you just do this. Sorry, let me show you. Just do this until the ginger's heat up, and the ginger will transfer the heat to the point. Right, so you can hold the ginger and put it very, very close and push it on the point, and keep doing this. It's so simple. Just keep doing it for 5 minutes. And how often should you do it? You do it every day. Every day for 3 times. Every day, 3 times. At least 5 minutes. You can do it for more. Alright? You can do it for more. So this is what we did for my wife when she had a daughter. Before she had a daughter, she experienced threatened miscarriage. So this is something that she did every day, and we do acupuncture. We did acupuncture for her as well. So if you experience for that, come for acupuncture. And she also took some herbs, Chinese herbs for it. What else? Yeah, if you need any of this, contact us or put the comment down there, and come and get this moxibustion stick. Buy from us. We do sell it in our clinic, so come to us. If you experience miscarriage, you're not quite sure what's happening, and you want to get pregnant again, come to us. We can give you the information, and we'll give you initial examination, and then we'll go through it, and we'll figure out what's going on. So most of the time, the threatened miscarriage, or you experience miscarriage and you can't find any reason for it in the Western medicine, but in Chinese medicine, we actually be able to figure out what's going on according to Chinese medicine. So it's quite a different idea. All right, that's it for today, and thank you, and please give me a thumbs up and follow us. And tomorrow, Daisy, my colleague, she's going to talk about PCOS, Acupoints for PCOS, and that's tomorrow 9 o'clock. So every day we're gonna meet you online for a live video and give you some tips. Stay awesome, and we'll see you tomorrow. Bye bye.